go live now.
Good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patients to access the right treatment on right time. It is my immense pleasure to introduce Dr. Krishnamani, an esteemed and experienced medical professional specialized in medical oncology. Dr. Krishnamani has more than 10 years of experience, and Dr. Krishnamani is associated with American Oncology Institute, Hyderabad. With a wealth of knowledge, Dr. Krishnamani brings us passionate and patient-centric approach for cancer management and treatment. So in today's live session, we are going to discuss on something very suspicious. The topic is like approach to suspicious of cancer. So Dr. Krishnamani will guide us how to deal if a cancer screening finds out something suspicious. So without any further delay, I extend a warm welcome to Dr. Krishnamani. Dr. Krishnamani, good afternoon and welcome to the live session, Doctor.
Good afternoon. Welcome everyone to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. Today's session is on suspicion and how do you deal with the suspicion of cancer? What are the first steps we take when we suspect cancer in someone? How would somebody learn that they are probably harboring something which is probably a cancer and when they should seek medical attention? So today's entire discussion is going to be centered on that.
Actually, doctor, this topic will be frankly very helpful because many of them think they stay in a confusion mind, whether it's a cancer, I have a cancer, no cancer, yes cancer. Many questions are there, doctor. So without any further delay, doctor, just to start, how can we suspect if someone is having cancer, or like what are the common symptoms for someone is having a cancer?
Yeah. So try to divide this symptoms into two types. One is cancer specific symptoms, one is cancer non-specific symptoms. So let us go to cancer non-specific symptoms first. Somebody who is having extreme loss of appetite for some period of time, maybe more than a month, extreme loss of weight, unintentional weight loss. You're intentionally losing weight, you're not taking rice, sugar, that's different. Unintentional weight loss over a period of 4 weeks or 1 month or more than that. So it is not a short period, it's a fairly long period. That's what I'm trying to say. So symptoms which last for a longer period, that is usually more than a month or two, like unintentional loss of weight, severe loss of appetite, continuous fever which is not getting down, a tremendous feeling of loss of energy, drive, weakness, a lot of weakness, getting bedridden, or slowly the activities are coming down. A person who is very energetic is now not able to have that energy. These are all the symptoms. Or you do a blood test and that shows fall in hemoglobin, WBC, or platelet, or something like that. Yeah. So these are all the non-specific symptoms. It is not related to a particular cancer. Broadly, any cancer can lead to these kind of symptoms. Now, cancer-specific symptoms go by the common cancers. What is our common cancer? Lung cancer. How can lung cancer present? Lung cancer presents with breathing difficulty, okay, which is progressively bad, cough, blood in the sputum, okay, chest pain, those kind of things. A breast cancer presents with a breast lump or an armpit lump. Stomach cancer or a food pipe cancer presents with difficulty in swallowing, including water and vomiting. Okay. And then cervical cancer or uterine cancer presents with bleeding. Yeah. So these are all, and head and neck cancer presents with an ulcer in the mouth, or it can present with a nodule or a small swelling. Now, if these same cancers spread to other organs, if the cancer spread to the brain, you can have severe headache. You can have weakness of one side of the body. You can have double vision. You can have fits. If it goes to the lungs, you can have breathing difficulty. It goes to the liver, you can have pain in the right side. You can have jaundice. So what you're basically trying to say here is cancer symptoms are varied. They can be non-specific, like fever, weight loss, loss of appetite, weakness, which is there for a longer period of time, or specific symptoms for each organ.
So in short, doctor, we can say that like some side effects, like in a daily routine, slowly the patient is his activities are coming down, and apart from the 2 to 3 days continuous, if some indications or some symptoms are there, it is better to go and consult a doctor at that time.
Yeah, see, 2, 3 days means you have some kind of an infection, most probably a viral infection, those kind of things. Anything which is there for a longer period. Now, for example, there is a dictum in medicine. A pneumonia which you are treating, which is not getting better in 4 or 6 weeks. Pneumonia means an infection in the lung, a bacterial or a viral infection in the lungs.
Yes.
Usually gets better with antibiotics. You have on the X-ray, you have a small patch. You have a patch on the X-ray. Now the patch is not going off after antibiotics. If you are not improving after antibiotics, suspect lung cancer. So the bottom line is anything unusual and which is getting worse even after treating for the usual things and which is lasting for a longer period of time, not short period of time, generally, then suspect cancer, go to your doctor, get yourself evaluated. And you have risk factors like you constantly smoke, then you have a risk of lung cancer. You take tobacco, you have an ulcer in the mouth, you have a risk of head and neck cancer. Okay, so as we have discussed in our previous shows too, that if somebody who has a higher risk in the form of what do you say, promiscuity in the form of multiple sexual partners or those kind of things, they are at risk of cervical cancer. Somebody who has a strong family history of breast cancer presents with a breast lump, especially in a young person, should not be ignored. You may have breast cancer which is genetically related, like BRCA1, BRCA2. So, if there are risk factors, there is no age now. We know that any age, cancers don't respect age. Okay, so any risk factor, any unusual symptoms, there for a longer period of time, I think not wrong to go and seek medical attention.
Very truly said, doctor. Then, doctor, are there any initial examination available to suspect or?
So, what do we do? So, when somebody comes to me with a suspicion of cancer or a doubt of cancer, the
Hmm.
first thing what a doctor will do is take a history. You ask them,
Hmm.
okay, now suppose somebody comes with fever, 2 days duration, body pains, okay, running nose, sore throat, eyes are all watery, then you know it is probably a viral infection. The same fever for 3 months, not reducing, taken treatment for malaria, for typhoid, for bacterial infection, still not improving. The WBC counts are very high or extremely low. Okay, bad cells in the form of blasts are seen. Then you know you're dealing with a blood cancer. Okay, so first thing is a history. The most important things in history are symptoms,
Hmm.
duration,
Hmm.
those kind of things. Then you will examine a patient. So when we examine a patient, what are you going to look at? You're going to look at the eyes, the ears, nose, throat. You're going to look at the lungs. You're going to look at the abdomen. Okay. You're going to look if there is any bleeding in the skin or red spots under the skin. You're going to examine all the lymph nodes in the neck, in the groin, in the armpit. So this will give you clues. If I find red spots under the skin, I'm very sure this patient has a low platelet count. If the lymph nodes are enlarged, it could be a cancer which is spread to lymph nodes or a lymphoma where the cancer starts in the lymph node. If the liver or spleen is very enlarged, then it could be involved due to cancer, due to spread of cancer. Okay, so this examination, if there is decrease in breath sounds in one lung, then maybe there is water in that lung, around the
Hmm.
lung, which is called effusion, pleural effusion, we say, when the patient also has breathing difficulty. So all the symptoms you're going to ask in the form of fever, weight loss, loss of appetite, systemic symptom like headache, seizures, double vision, breathing difficulty, chest pain, cough, and then abdominal pain, jaundice, bowel, bladder. You're going to ask all this. You're going to ask for family history. You're going to have ask for risk factors like smoking, tobacco, alcohol, hepatitis, HIV, whether you're vaccinated for cervical cancer, whether you're vaccinated against hepatitis B. And after that, you're going to examine someone. And when you're going to examine someone, you're going to go from head to toe. Our teachers always used to say, there is nothing shameful in touching the leg of a patient. So that is the first thing we actually do. The minute a patient is lying down, we actually touch the feet of the patient. What all information that gives me? It gives me whether there is swelling in the limbs. I can look at the color of the skin. If it is very dark in color, that means the blood supply is less, or you may have some skin conditions. If it is very painful to touch, it means you have some infection called cellulitis. We have to look at the nails, whether there is some infection. Just touch and see the blood flow in the lower limbs. There's an artery there in the foot, which is called the dorsalis pedis. You just, like how you touch the pulse here, radial artery. If this is the foot, you will keep your three fingers and see if the blood flow is okay. If I'm a chronic smoker, if I'm unable to walk a few steps, the history will be, suppose a person comes to you saying that I'm a chronic smoker. I used to walk earlier 3 miles, 4 miles. Now I have to 10 steps and I have to sit down. My legs ache a lot. And then I have to restart. That is called claudication or pain in the limbs. And when you give rest, the pain reduces because the blood flow starts. When you're walking, there is no blood flow. So how are you going to check it? Keep your hand, keep your fingers and see. If the blood flow is less, that means all those arteries have been blocked because of your smoking. There is no blood flow to the leg. That's why the nerves in the leg are crying. That's called the crying of the dead nerves, because of which you get the pain in the limb. So see, this is not related to cancer, but this is how you try to make out things while examining a patient. Look for lymph nodes, look for liver and spleen, look for lungs, auscultate, look for the arteries, skin.
So I guess, doctor, just the word initial examination seems very small, but the main decision making lies under that, if I'm not wrong.
Yes, and as our teachers used to say, always examine a patient in a bright room with natural light, not like how I am sitting, you are sitting now in a room with lot of artificial light. So a
Yes.
bright room with natural light gives you more information when you look at a patient. You never look at a eye in a dark room, because in a jaundiced eye should never be seen under a tube light. A jaundiced eye should always be seen in a bright, well ventilated natural room with natural light.
Sir, nowadays everything is concrete, and inside that concrete there is a beautiful glass wall covered to that concrete walls.
Correct.
Natural light
And
is,
just to add, if any medical professionals are seeing, just to add, whenever you're examining a female patient, you're going to have a lady beside you. That's very, very, very important, extremely important. Since we are talking about physical examination, how
yes.
we do, what are the surroundings, how it should be. For a woman, when you're examining a lady, have a lady beside you. Could be your colleague, could be a nurse, could be anybody. Okay. And obviously respect the privacy of each individual, be it male or be it female.
Very important point, doctor. Doctor, now, like, what are the different tests available to diagnose cancer, doctor?
So again, this is as my teacher used to say, when somebody comes to you with a suspicion of cancer, how are you going to work up this patient? So he used to say, I am going to do tests first to confirm the diagnosis. Next, I will do tests to stage the disease. If it is confirmed, which stage it is. So tests to stage, wherever it has spread. Third, I will do tests to assess the general condition of the individual. Okay. So if this, you put it in these three headings, life becomes very simple. So I am going to do test to diagnose the disease. So I have to diagnose somebody has cancer when they come with a suspicion. So what is the test to diagnose cancer? A biopsy. Biopsy is a needle test. We take a small piece of tissue from the swelling or a tumor and send it to the lab. If cancer cells are seen, the person is diagnosed with cancer. Biopsy, most, what shall I say, in most cases, or in almost all cases, if you do a needle test, it does not spread the cancer. So this is a psychological feeling carried by people that, Dr. Saab, if you do a needle test, our cancer is going to spread. No. There are few tumors where we would not do a needle test, which we have discussed, like an ovarian cancer presents with just an ovarian tumor, no disease elsewhere, or a kidney tumor, just as a lump in the swelling in the kidney and no other disease. Apart from these, you will always do a biopsy. It is a needle test. So I will do a test to confirm the diagnosis of cancer, and this test is called a biopsy. Two, I will do tests to stage the cancer. So once the report comes and says you have head and neck cancer or you have lung cancer, next question is stage. I will do tests to stage. Stage is to see where all it has spread. So One, you will do clinical examination. It is called clinical stage. Clinical stage is, suppose I examine the breast. If there is a 4 centimeter lump, it has spread to the lymph nodes. So I will say it is a lump in the breast, which is above 2 centimeters. So we call it T2. 2 to 5 centimeters is T2. So it is 4 centimeters. So it is T2, and N node is 1 because it has spread to the lymph node. Next is M, metastasis. Has it spread? We don't know. We cannot look inside the body. So for that, I am going to do test in the form of ultrasound or X-ray or a CT or MRI or PET-CT. So this is the test to stage the disease. Third, I am going to do tests to aid my diagnosis. Now, sometimes you have blood tests. Prostate cancer, you do PSA. If it is 500, normal is less than 4. So that means this person probably has prostate cancer. Ovarian cancer, 70% people can have elevated CA-125. It's a blood test. So lastly, I am going to do tests to assess the health of the individual. You have to do basic blood work, kidney function, liver function tests and all that. So patient comes with a suspicion of cancer, you take a detailed history, you examine the individual, and then you do tests to confirm the diagnosis by biopsy, to stage by scans, to assist your diagnosis by blood tests, and finally to assess the health of the individual. I can be a dialysis patient, so my creatinine will be high. How will you know? So do a kidney function test. I may be an alcoholic, my liver is bad, do a liver function test. So do a complete blood picture, liver function, kidney function for all patients, maybe a heart test also called a 2D echo and an X-ray to see the lung to assess health of the individual. This is the 4 ways you're going to assess or investigate somebody even before you start treatment.
Doctor, like in the third point, when you are saying about the finding out the which stages. So is there any test specifically, or you can enlighten us the test for the stage disease?
So staging for different cancers is different. Now, if you talk of lymphomas, we generally say do a PET-CT scan and do a bone marrow test. Or take some fluid from the spinal cord and send it for testing to see if the brain and the spinal cord is involved. Now, if you talk about an early breast cancer, a chest X-ray, ultrasound is enough to talk about the lungs and the liver. If you're talking about an advanced breast cancer, big tumor, spread to lymph nodes, you can probably do a CT or a PET-CT. If you're talking about gynecological malignancies like ovary and endometrium, that is uterus cancer, MRI pelvis is a better test. If you're talking about the brain, MRI brain is a very good test, not a CT scan or not a PET-CT. So all these imaging methods or scans, which we commonly call, one scan is not for everyone. Some people come and say, doctor, you do a PET-CT, I think it will take care of everything. No. PET-CT is for certain diseases only. In India, because it is so cheap and widely available, we use it for anything and everything. But ideally, as I just told you, you're going to have very specific indications where you're going to do PET-CT. And each tumor, you have to have a different philosophy to stage. You will
So
do an
in
endoscopy for upper GI malignancies. You will
yes.
do a colonoscopy for lower GI malignancies. So all this you have to incorporate.
So in short, doctor, different cancer disease or disorders, different stages or different types of diagnostic machines or the tests
Yes.
are used.
One size doesn't fit all.
Oh, that's quite complicated, doctor.
Not really. But the thing is, we should follow a systematic approach.
Okay. Doctor, many times when we read on Google also, they always highlight about the tumor markers. Doctor, can you enlighten what do you mean by tumor markers?
So tumor, you are having some tumors secrete some substances which you can measure in the blood.
Okay.
That is called tumor marker. For example, prostate specific antigen PSA, prostate cancer, CA-125, ovarian cancer, HCG, beta HCG, alpha fetoprotein, testicular cancer or germ cell tumors or ovary. Okay. CEA, colon cancer, CA 19.9, gallbladder cancer. Now, understand one thing. Tumor marker is detected in the blood. It's a blood test. You will
Okay.
usually get the report within hours to a day. Tumor markers, for example, Now, if I say PSA, normal value is less than 4. Each has its normal value. If my PSA is 10, that doesn't mean I have prostate cancer, remember. So
Oh.
PSA can be elevated in non-cancer conditions also, like infection, hypertrophy of the prostate. CA 125 can be elevated not only in ovarian cancer, but even during normal menstruation,
Oh.
pregnancy,
Hmm.
other non-cancerous conditions like endometriosis, adenomyosis. And it can be normal in 30% of women with ovarian cancer. So just because CA 125 is less than 35 normally, if your CA 125 is 80, it
Hmm.
doesn't mean you have ovarian cancer. And just because you have a normal CA 125, but everything else, including biopsy, is pointing towards ovarian cancer, doesn't mean you don't have ovarian cancer because your CA 125 is normal. Now, CEA, colon cancer. What are non-cancerous conditions? Colitis, ulcerative colitis, Crohn's disease.
Hmm.
CA 19.9, gallbladder cancer, but can also be seen in gallstones or blockage or cholangitis. So, these can be elevated in cancerous and non-cancerous conditions. They are not alone equal to a diagnosis, but they definitely aid in the diagnosis. And they are much simpler to do because they are a blood test.
Oh.
Where are they most useful is in conditions where the patient is very sick, you are unable to do a biopsy, or a biopsy is dangerous for the patient. If any of these are so highly elevated and the clinical picture also fits like a cancer, then you can say, okay, this looks like this cancer, so let us treat. But otherwise, just because a CA 125 is elevated doesn't mean you are getting away with a biopsy or not doing a biopsy and start treating a patient. And they can be seen normal or benign conditions. Remember that non-cancerous conditions.
So, in short, doctor, just for more clarification, along with normal diagnosis, cancer normal diagnosis test, which we have discussed in this video, along with the tumor markers are essentially done, or it's like optionally done?
So in a lung cancer, I will not have a tumor marker. But for an ovarian cancer, I will do CA 125. In a muscle tumor, I will not have a tumor marker. But in colon, I will send CEA. So there are
Okay.
few tumor markers and they are site specific.
Hmm.
Now, with a woman, why will I send a PSA? In a male, why will I send a CA 125?
Not
So
required.
they are not cancer specific, they are organ specific.
Oh.
So prostate specific antigen is not prostate cancer specific antigen. It can be seen in normal conditions also like infection and BPH.
Okay.
And I'm not going to do this test in everybody. If a woman comes with a breast lump, why will I send a PSA?
No.
So my asking for tumor markers will be very selective. If a patient doesn't want to undergo biopsy also, if he says, no, 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 send these blood tests, we are not going to do that. The first thing is always a biopsy. The second thing is staging. The third thing is tests to aid your diagnosis like tumor markers. Fourth is general condition of the patient assessment.
Yes. So, just for information, doctor, I asked, doctor, then what is there any genetically suspicious of cancer, genetic related something?
So we have discussed again this in our previous episodes where 10% of cancers are usually attributable to genetic factors.
Mm.
Now, the most commonest cancer, which all of us have read so much, is breast cancer and ovarian cancer. That is called HBOC, Hereditary Breast Ovarian Cancer Syndrome. Hereditary Breast Ovarian HBOCS. That is
Cancer
hereditary,
syndrome.
comes from generations, breast and ovarian cancer syndrome. Okay.
Mm.
So, a group of women who are young, who have multiple members in the family affected with breast cancer, or
Mm.
both sides breast cancer, or very early age breast cancer, predominantly triple negative breast cancer, that is ER, HER2, or breast and ovarian cancer, okay, or male breast cancer. These are all the persons in whom you are going to evaluate for a gene in the blood called BRCA1 and BRCA2.
Okay.
So now if this patient comes to me,
Mm.
let us talk about a story. A lady comes to you with a breast lump.
Mm.
Then it's a 3 centimeter breast lump. She's hardly 24 years.
Oh.
24-year-old woman, 3 centimeter breast lump. There are large lymph nodes in the armpit. So what are you going to do? You examine her. There is nothing elsewhere. You will do a biopsy from the breast. It comes as cancer. The next you do a CT scan. It has not spread anywhere. Well and good. This lady also gives a history saying that, sir, my elder sister has been diagnosed at 32. My mom has been diagnosed at 45. My mom's younger sister has cancer. My mom's older brother has male breast cancer. So then you know there are so many people that you have to test this woman for genetic evaluation and you will send her tumor for BRCA1, BRCA2. In colon cancer, if many people are affected, we look at something called Lynch syndrome or hereditary polyp syndrome.
Hmm.
So each cancer you are going to be very specific. Now, if my grandfather used to chew tobacco and he got head and neck cancer, if my father smokes constantly and gets lung cancer, I am not going to do any genetic test on them or on myself. These are habit related. These are that just because grandfather, father, then son doesn't have a risk because this is habit related. This is not, so you're not going to blindly say that no, 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 2 generations had, 3 generations had. No, no risk factors apart from probable genetic, multiple members affected, young people affected, a pattern, breast, bilateral breast, male breast, breast and ovary, young, triple negative, in a population of Jews, which is called Ashkenazi Jews.
Hmm.
These are all the conditions where you're going to send the test for BRCA testing.
Oh. So it's like after only entire diagnosis, you will confirm that whether this patient will have or will not have any genetical cancer.
Correct. And that takes traditionally 2, 3 to 4 weeks for the report to come.
Okay. So, doctor, in general, like for example, if a person mother is having some blood cancer, just an example. So the it is better a child should be tested with this kind of suspicious before
No. So
diagnosed, or
you
it's
are
not
there are
required.
millions of cancers. So you have going to have millions of patients. You can't test all their siblings and their children. Then it is so you are going to be very, very selective, as I told you. So in those group of patients only, you're going to start testing.
Okay,
You
okay,
find
okay.
you do my blood test now, suddenly you say some XYZ mutation is there. What is the and what is the understanding of that mutation? Nobody knows. XYZ can cause, will it cause cancer? Won't it cause cancer? Now, lifelong, you put a thing in my head saying that I'm having a mutation and I am constantly sitting on a time bomb saying that when I will get cancer, when nobody in the world knows what that mutation means. So just testing doesn't mean anything. We should triage our testing in such a way that it should be done with the highest probability of detecting something and in a very specified population.
In fact, doctor, there is a myth, I will say. Many of them people think that, okay, my mother had a cancer, I can also have cancer. My father
Hmm.
had a cancer, though it is an habituated cancer, like you have told, because of tobacco or smoking. But
Hmm.
still, the children will think that, I can have cancer because my dad had it.
Agree.
So that is something, a myth is highly dominating everybody in the younger generation.
True.
So that is something, doctor, which was, in fact, doctor, there are many confusing questions still. I think there will be with our audience as well, because this topic itself is so in depth. How much information you collect, it will be still incomplete, if I'm not wrong.
Correct. So the whole point of this question and answer session today was when the patient walks into your room with a suspicion of cancer, how are you going to approach? One, history. Two, physical exam. Three, tests being ordered. And
Yes.
then subsequently, you're going to sit and analyze those tests. So that will be part of a later session where we are going to sit and work up on the information that has come after today's discussion or after today's analysis of a patient.
Thank you, doctor. This information, I hope everybody over here will be very helpful. Thank you, doctor, very much for this wonderful, enlightening session on suspicious of cancer. Doctor, would you like to give something, a closing comment to this session, doctor?
Yeah. So cancer is let people be aware that cancer is very common, but doesn't mean that you have to be scared of any symptom which is equivalent to cancer. As we have discussed, any symptoms which has been there for a longer period of time and despite treatment, if it is not improving, then go consult your doctor just to rule out if you have cancer. And that could be non-specific symptoms like weight loss, loss of appetite, weakness, losing muscle mass, or specific organ-related symptoms, commonly related to breast, lung, ovary, uterine cancers. Okay, um, upper intestine, upper is foot pipe and stomach cancers, which can lead to difficulty swallowing. And if somebody elderly man sees blood in the stool, then you should suspect colon cancer. So these are all the things. So don't be scared. But if there are alarming symptoms, please seek medical attention so that you are diagnosed at the earliest, because cancer, if detected early, is curable. That's the tagline.
In fact, doctor, everybody still, as you told, that death is a time bomb when they listen, like, I have cancer. So, frankly speaking, everybody should be informed. And obviously, any habituated thing which leads to cancer should be avoided. So, thank you, doctor. Thank you, everybody, for joining us today. So, as doctor rightly said, you all should be stay informed, stay healthy from Cancer Reach. Thank you, everybody.
Thank you so much. Bye.